Hi, Tony DeWitt here, Missouri appellate attorney and a guy who likes to make the law make sense on YouTube. So I have a question for you this morning. When your child goes back to the dentist, do you go with him? Maybe you should. I'll have more in just a second. Today I'm going to talk about a case that I was involved with several years ago that involves another whistleblower. Another true hero in my opinion because he stood up for what he believed was right. Now, I don't want to identify him just as I didn't identify the other one, but let's call him Alex. Alex was 19 years old and working his first job in a dental clinic. Now, he wasn't a dental hygienist, he was just someone who assisted with various procedures. He didn't have any formal training other than the on-the-job training that the dental clinic gave him. And in the course of that employment, he became aware that the focus of the practice was predominantly on Medicaid patients. Now, most of us who have children and who don't have Medicaid understand that if we take our child to the dentist, we have to pay for that. We also understand that there's a great deal of value in taking your children to the dentist because A, it gets them used to going to the dentist, B, it helps them learn how to keep their teeth clean and looking good, and C, it helps identify problems early on. So we understand that, but we also understand that, it costs a little bit of money to go to the dentist, and that's okay. But with Medicaid, Medicaid only pays for certain things. It will not pay for a lot of what normal dentistry provides without a lot of thought. However, and so what it is designed to do is to treat the most serious kinds of problems for these children. And Medicaid is paid for partially with state dollars and partially with federal dollars. So anything that derives money from the federal government is a viable source for a False Claims Act case. And indeed, Medicaid does that. So over the course of his employment, he began to see a lot of things that he did not believe that he should be seeing. Now, children up to about the age of 6 predominantly have baby teeth. Deciduous teeth are sometimes called baby teeth. And baby teeth are the teeth that will eventually pop out and leave room for the permanent teeth to grow. It is important to take good care of those baby teeth because they sort of form the foundation for the teeth that come in later. And that would ordinarily not be a big issue, but it became an issue in this case because this particular practice figured out that you could make a lot more money by doing things to baby teeth that you would never do in a regular practice because it wasn't justified. You couldn't go to a parent and say, we're going to charge you $500 to put caps on your child's baby teeth that are going to pop out in about 6 months, because no parent would let you get by with that. But what these folks did, and you have to understand, the people who are coming to this clinic are predominantly low income, sometimes no income. They're single moms, single dads, people without a great deal of sophistication, let's say, with regard to how healthcare works. And what happened was they would come in, they would detect some kind of anomaly with the teeth, and they would numb up the mouth and grind down the teeth and cap these baby teeth, and they would bill Medicaid for that amount. Well, anytime you do something that is medically unnecessary, Medicaid is not supposed to pay for it. But Medicaid doesn't have somebody in every dental clinic saying, I don't know, I don't think that's necessary, I think you better not do that. Instead, what they rely on is the professional integrity of the people who operate in those clinics. Unfortunately, a lot of people see both dentistry and medicine, and yes, even law, as a quick trip to instant riches. And sometimes it can be, But most of the time, when you're taking the easy path, it's the road to perdition, and it certainly was here. It's interesting to note, however, that our little 19-year-old relator did not recognize the impact of what he was seeing. What brought him to see us was the fact that the practice depended on a high volume. In other words, they wanted every dentist to see an unreasonable number of patients every day in an 8-hour period. So oftentimes they wanted people to see 20 patients during a day. And in order to do that, the patient had to be ready to go the instant the dentist walked in the room. Because the patient had to be ready, there was not the sort of kindness that often comes in regular practices. Mom and dad are allowed to go back, get the child settled in the chair, hold their hand while the doctor does whatever the doctor needs to do. In fact, many of the children were so traumatized by what happened that they probably will never go get dental care again in their life. Because here is what often happened with those children. They would go in and go to the back, and somebody would pick them up and put them on a papoose board. Now, what a papoose board is something where they put a strap across the head. They put almost like straitjacket straps across the body of the child, and they tug them down firmly so that the child can't move or squirm. And obviously, when you're 2 or 3 or 4 or 5 years old, that is terrifying. And the kids would scream. And as a result, they would go in, and a lot of times, for example, in my dentist's office, when I go in, they have a little swab, and they swab the inside of my mouth before they give me the shot, so it doesn't hurt. Well, that kind of attention to detail was nowhere to be found. They would go in, they would hit these children with the little numbing drops or the numbing medication along the jawline, and then they would immediately start to work. Oh, the anesthesia hasn't started to work? Oh, well, they're going to scream anyway because they're papoose down and they can't move and they can't resist, so we can still use this to get a lot of patients through here every day. When our whistleblower told us that one of his jobs was to take a hairdryer and dry the pants of children who were so scared that they voided on themselves, I knew this was a case that I had to be involved in. We got some very good dental experts, former members of the American Board of Dentistry, and we got those people involved because we believed this was a terrible, terrible case. Well, the False Claims Act has what's called a first-to-file rule, and so the first person who blows the whistle is supposed to be the person that gets the money. But our little 19-year-old was not the only person who was outraged by what he saw. There was a very good dentist in Connecticut who saw the same thing. There were several dental people down in Texas who saw the same thing, although they were more outraged by the financial end of it because the reason they became whistleblowers was because they started getting less money. The motivation of the whistleblowers was important to me. It's never important to the government. The government is just glad to get good information that they can go and get additional money from. Now, before we went forward with this case, or I should say at about the same time we went forward with this case, this was a national chain of dental clinics, and they put themselves up for sort of offer at the highest bid, and one of the bids was $350 million for this chain of practices. Well, we figured conservatively that the damages under the False Claims Act would be more than $350 million. And that's what we told the government. That's what our experts told the government. And our government began a look at this particular case, and it was assigned to the U.S. attorney out of Tucson, Arizona. Unfortunately, right after this happened, Gabby Giffords was shot in Phoenix, and they pulled that U.S. attorney up to Phoenix to handle that case. So nothing happened on the case. Eventually, the lawyers at the main Justice Building in Washington, D.C., picked up on the case, and they transferred the case from the District of Arizona up to the District of Connecticut, where a similar case had been filed, and they consolidated that case. From the day we filed the case in Arizona until the day it was finally wrapped up, it took 9 years to get to that point. During that 9 years, we had to fight with the government over what the scope of the case should be. We had to fight with the other relators who believed that even though they were the last to file, they should get the most for what they had done. And while our relator didn't really care that much about the money, he was going to use it to go to nursing school, I cared about it because it was simply the wrong thing. Rewarding someone for being the last to file encourages people to wait until the greater amount of damages has been sustained by the government. You want them to blow the whistle early so that the government can cut off the behavior that is costing the government money. This works for all of our benefits. So, to make a long story short, the case ultimately settled with the company, and you're not going to believe how much. Because the company said, "Oh, poor us, all of this publicity has cost us money, and we can't pay this huge amount that you're asking." The government settled with them for $20 million. $20 million for torturing children. I believe that was probably one of the worst resolutions ever in the history of the False Claims Act. But I want to be clear here. I do not blame the U.S. attorneys that were involved or the main justice attorneys that were involved. And I blame just sort of the whole 9-year time frame that it took. I think the attorneys at the Department of Justice did the best job they could. They got the most money they could reasonably expect to get without putting this practice into bankruptcy. Because apparently the Department of Justice does care about putting people into bankruptcy and about costing people their jobs. As far as I'm concerned, when part of your job is to torture children with dental tools, you do not deserve to have a job. But that's the Department of Justice's policy, and it's not for me to say whether that's right or whether that's wrong. Again, eventually the case was wrapped up and did quite well. I think it's important for me to point out here that if you know someone who is violating the law and they are charging the government more for something than they should be charging, if they're billing fraudulently for services that are not being performed, if they are cheating the government out of money in some recognizable way, you not only have an incentive to blow the whistle, I believe you have a moral duty, because allowing that to go on is stealing from your friends and neighbors and everybody who pays taxes in this country. So I would encourage people who believe they may have such a claim to consult an attorney in their area who can help them decide whether they have a viable False Claims Act case. If you have any questions on this, please feel free to leave them in the comments down below. Otherwise, you know what to do. Like, share, subscribe, tell your friends and neighbors. And if you would, please take a moment to leave me a comment as to whether or not you like this format where I tell you about a case. I don't want to come off as self-aggrandizing and, oh, boy, look at me, But what I do want to do is let you know some of the significant lessons that I learned practicing law and that might help you down the road. Thank you again for watching. Have a terrific day. I'll catch you on here next time. If If you like this video, here are a few others you might try, and don't forget to subscribe. Have a terrific day, guys.